Dr. Fiona Atebwe, and welcome to the WHO Africa Media Press Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. You can select the language in which you want to hear this press conference by turning to the bottom right of your Zoom application, selecting the globe and choosing your language. We shall also give you a chance to ask your questions either live or using the Q&A function of your Zoom application. And now, joining us from Brazzaville, Congo, we have the Regional Director of WHO Africa,
Nous
Dr.
avons le directeur
Masidiso
régional
Moeti,
de la région africaine de l'OMS, le docteur Moeti,
who I will now give the floor to
à
let
laquelle je
her
donnerai
introduce
maintenant la
our
parole
other
pour qu'elle puisse
panelists.
présenter les autres panélistes.
All our colleagues in the media and everyone watching
Alors,
online.
bonjour chers collègues des médias et tous
Bonjour,
qui nous suivent en ligne.
Colombia. I'm very pleased to be joined by the Honorable Minister of Health of Lesotho, Mr. Semano Henry Sekake. Welcome, Brother Minister. We look forward to hearing about the rollout of COVID-19 vaccines in Lesotho. I'm also very pleased to welcome Her Excellency Stephanie Seydu, the Ambassador for Global Health at the Ministry for Europe and Foreign Affairs in France. Bienvenue et merci beaucoup, Madame l'Ambassadeur. She is going to talk about France's decision to share COVID-19 vaccine doses with other countries through the COVAX facility. There have now been more than 4.7 million COVID-19 cases and 128,000 lives lost on the African continent. For the past 3 weeks, cases had declined, but this week we are seeing an increase, in fact, of 17%, with 65,000 new cases reported. While it's too soon to say if Africa is seeing a resurgence, however, we're seeing increases in a number of countries. We are monitoring the situation very closely, and we see that we are balancing on a knife edge. South Africa accounts for almost a third of these new cases, with 2 out of 9 provinces already experiencing a third wave, but in fact, most of the provinces seeing an increase in the number of cases. Population fatigue in adhering to preventive measures, the circulation of variants, and cooler weather in Southern Africa is driving people indoors and could be contributing to these increases. We are concerned that increases in South Africa could spread to neighboring countries, as has happened before. And note that Namibia and Zambia, for example, are among 11 African countries experiencing an upward trend in cases. So this makes the rapid rollout of COVID-19 vaccines all the more important. Almost 6 months after the first COVID-19 vaccination campaign started globally, less than 2 doses per 100 people had been administered in sub-Saharan Africa. At a minimum, Africa needs at least 20 million AstraZeneca vaccines by mid-July to deliver second doses to everyone who received their first shots. Africa needs vaccines now. Any pause in our vaccination campaigns will lead to lost lives and lost hope. Another 200 million doses are needed so that the continent can vaccinate 10% of its population by September this year, as called for by the WHO Director General at the World Health Assembly this week. As WHO, we are appealing to countries that have already vaccinated their high-risk groups to significantly expand and bring forward their pledges and actions to share doses. Dose sharing is an urgent, critical, and short-term solution to ensuring that Africans at greatest risk from COVID-19 get gold standard protection. We also appeal to manufacturers to ensure that countries can contractually give doses to the COVAX facility. Vaccine manufacturing in African countries offers much promise. Investments should take a long-term view, including vaccines for other priority diseases, using different vaccine platforms and pursuing coordinated multi-country approaches. Ratifying the treaty for the African Medicines Agency is a key step that all countries on the continent can take to strengthen the regulatory environment for local production. Finally, next Monday is World No Tobacco Day. Tobacco kills half of its users and globally every year, around 1.2 million non-smokers die from exposure to tobacco smoke. This year, we're urging tobacco users to commit to quit, and we are working with countries to improve access to supportive services such as toll-free quit lines, nicotine replacement therapy, and text messaging and other information tools. Reducing tobacco use will save lives, save money, and create healthier societies. So I look forward very much to our conversation with our two honorable panelists today and with you, our journalist colleagues. And thank you very much for joining us.
Thank you very much, Dr. Moeti. And now we turn over to Lesotho. Honorable Semano Sekatli, how is Lesotho's COVID-19 vaccine rollout going?
Thank you very much. Good day and greetings to you, Dr. Moeti. I thank you for inviting us to speak today. COVID-19 vaccines, we believe, are the last straw that will break this monster's back. Lesotho's vaccine rollout would not have happened if it wasn't for us engaging into developing a comprehensive plan that would guide the vaccination program. I thank all the people who were involved, and many to count, actually, to develop the Lesotho National Deployment Vaccination Plan. Back in March this year, we were expecting about, or at least 132,000 doses from the COVAX facility. We only received 36,000 doses. Understanding the existing challenges in terms of supply, we adopted the attitude that half a loaf is better than no bread, and that a bird in hand is better than two in the bush. I'm glad and delighted to report that the 36,000 doses that we received, we have to date managed to vaccinate about 36,819 people. We have strictly followed and adhered to our National Deployment Vaccination Plan. We have now partially covered the first phase of that plan. This phase had prioritized our frontline workers, particularly the health workers, including village health workers, the vulnerable, people with comorbidities. We are gratified that to date, we have been able to vaccinate 95% of our health workers. The doses that we have, or we had, have been wiped out. We are now stuck. On the other hand, the demand for vaccines has shot up. Our health centers had to return people without being vaccinated. It is simply embarrassing, to say the least. But thanks to France for coming to our aid. The recent donation by France to the COVAX facility will save us from this embarrassment. We encourage and appeal to all other countries with surplus doses of vaccines to do likewise. In fact, to do what is the right thing to do, to save lives and to restore normalcy in the social, political, and economic activities of the world. Anyway, it is only the sensible thing to do. In conclusion, I must thank you, Dr. Moeti, and your staff, the COVAX facility, UNICEF, and in anticipation, the AU and the AFAT facility. And indeed, the many people who are doing everything in their power to ensure that the world gets the vaccines we so desperately need. Thank you very much.
Thank you very much, Honorable Minister of Health from Lesotho. Yes, we hear you loud and clear, and thank you for that excellent breakdown, a mix of success, but also a call of appeal to wealthier nations. Now, Your Excellency Stephanie Sedou, can you please tell us about France's decision to share COVID-19 vaccine doses with Africa?
Merci beaucoup pour cette opportunité
Thank
de
you very much
m'adresser
for this
à
opportunity.
cette belle assemblée. Je vais désactiver, pardon, l'interprétation. Voilà. Je suis très honorée de parler après le ministre de la Santé du Lesotho, que je remercie pour ses paroles. Bien sûr, la crise du Covid a mis en évidence les difficultés dans l'accès équitable, qui pour autant est une des conditions de réussite pour vaincre cette crise, comme l'a bien rappelé la docteure Moeti en introduction. Et même si l'Afrique peut sembler plus épargnée que d'autres régions pour le moment, il est évident que l'Afrique doit pouvoir bénéficier, comme l'ensemble des régions, de l'ensemble des outils nécessaires pour lutter contre la pandémie et au contraire profiter du relatif répit qu'elle connaît pour le moment pour accélérer autant que possible sa campagne de vaccination. Pour cela, il faut naturellement un ensemble d'outils, des diagnostics, des traitements, des équipements de protection et les vaccins dont je vais parler dans un instant. J'aimerais simplement dire que dès le début de la crise, la France, par la voix du président de la République, Emmanuel Macron, a souhaité promouvoir la mise en place d'un mécanisme solidaire, multilatéral, pour précisément bien adresser la question de l'accès équitable. Et ce mécanisme, c'est ACTA, Access for COVID Tools Accelerator, qui traite bien de l'ensemble de ces sujets, comme d'ailleurs de la dimension très importante du renforcement des systèmes de santé dont chaque pays est bien conscient et qui, bien sûr, fait toute sa place aux plans nationaux de lutte et de réponse à la crise, dans le cadre desquels doit s'insérer la diffusion des outils dont on vient de parler. S'agissant de cette initiative ACTA, vous savez qu'elle comprend une facilité COVAX qui est plus particulièrement dédiée à l'accès aux vaccins. Et on peut dire qu'aujourd'hui, cette facilité COVAX est bien amorcée puisque 72 millions de doses ont été livrées dans 126 pays, parmi lesquels 77 pays à revenus faibles et intermédiaires. Alors, la France a été le premier pays à voir la nécessité de partager tout de suite les doses dont elle disposait. Et c'est ce que nous avons fait dès le mois d'avril, à l'heure où nous vous parlons. Déjà, plusieurs dizaines de millions plusieurs millions de doses ont été partagées. La première centaine de mille doses étant d'ores et déjà déployées en Mauritanie et d'autres à suivre. Le président de la République a confirmé que nous livrerions 500 000 doses d'ici la fin du mois de juin, dans un mois, et 30 millions de doses d'ici la fin de l'année. Quand il s'est adressé au Global Health Summit le 22 mai, le président de la République a rappelé son ambition qu'un engagement international de grande ampleur suive cette action précurseur de la France. Il a dit « Le temps est venu de partager ». Et nous sommes très heureux de voir que les efforts de mobilisation engagés par la France commencent à porter leurs fruits, puisque à sa suite, l'Union européenne, la Commission a annoncé un volume cumulé de 100 millions de doses qui seraient données en 2021. Et nous voyons de plus en plus de pays européens s'engager, il y en a déjà 6, dans cette voie. La France va continuer à promouvoir cette voie également dans le cadre du G7. Et on a également un ensemble de pays qui s'intéressent à cette voie de solidarité, qui est aussi une voie pour permettre l'efficience de la riposte mondiale à la crise. J'aimerais dire quelques mots peut-être au-delà de, peut-être si un dernier mot sur la vaccination, les dons de doses pour accélérer la vaccination. Vous avez bien compris que la France a souhaité que ce don se fasse via la facilité COVAX, de façon à répondre à des critères d'allocation précisément efficients et équitables que détermine COVAX avec, bien évidemment, l'OMS, en référent essentiel. Un ensemble de critères rentrent en ligne de compte, l'état de préparation du pays et la pertinence de l'envoi des doses à un moment donné pour ces pays. Je rappelle que l'objectif de la France est que les doses bénéficient en premier lieu aux personnels de santé qui sont les plus exposés, comme l'a bien rappelé le ministre du Lesotho, et autres populations vulnérables. Nous examinons la possibilité de voir comment ces doses pourraient éventuellement, avec COVAX, aussi adresser les besoins humanitaires qui sont identifiés. J'aimerais passer peut-être à un autre point pour dire qu'au-delà des dons de doses, la France a identifié 2 directions dans lesquelles il serait particulièrement important d'agir pour accroître l'accès aux vaccins. Le président l'a rappelé devant l'Assemblée mondiale de la santé le 24 mai. La deuxième, après les dons de vaccins, la deuxième voie, c'est d'encourager les pays tiers à lever les restrictions aux exportations sur les vaccins et leurs composants. Et la troisième voie est d'accroître les capacités de production chez l'ensemble des partenaires, et en particulier en Afrique, avec le développement de plateformes de production. Sur ce point, il y a une initiative européenne qui est en cours. La France s'y impliquera fortement, à travers notamment l'Agence française de développement. Et nous sommes très intéressés par la troisième voie qu'a proposée la directrice générale de l'Organisation mondiale du commerce, la docteure Nkongo Iweala, avec un accent sur le développement des transferts de technologies et de savoir-faire, en s'appuyant bien sûr sur l'OMS et son expérience et sur des partenaires experts comme le Medicine Patent Pool, que la France soutient, y compris financièrement depuis sa création. Il y a eu récemment le lancement d'un hub sur les ARN messagers par l'OMS. Nous considérons que c'est une excellente initiative que la France va s'efforcer de soutenir. Je fais une rapide allusion au fait que demain, le président de la République française, Emmanuel Macron, qui est aujourd'hui au Rwanda, se rendra en Afrique du Sud, où il aura les entretiens au plus haut niveau avec le président Ramaphosa et où il fera des propositions précisément pour augmenter la capacité de production de vaccins en Afrique. Dernier point, dire que la France félicite et soutient la résolution sur la production locale de médicaments et d'autres technologies de santé qui sera adoptée lors de l'Assemblée mondiale de la santé qui est en déroulement actuellement. Merci beaucoup, je serai heureuse de répondre à vos questions.
Thank you very much, Your Excellency Stephanie Sedou. And now that we've heard from our panelists, it's your turn to ask your questions, dear journalists. And to do this, remember, you can use the question and answer function of the Zoom application. And also remember that you'll need to provide a name and the news agency that you represent to have your question answered. Also to note that on hand we have Dr. Nsenga Ngoy, the Incident Manager for the COVID-19 pandemic, and Dr. Richard Mihigo, the Coordinator for Vaccine Preventable Diseases Program, both working at the WHO Regional Office for Africa. So to start us off, I'll go to you, Rhoda Odhiambo from BBC Africa, to go live with your question.
Thank you, Dr. Tuhebwe. My question can be answered by either Dr. Moeti or Dr. Ngoe. So I'll first start off by looking at how countries are redistributing, sending back the vaccines to COVAX because of poor uptake within the communities in these countries. So how many African countries have returned the COVID-19 vaccines to COVAX? And in terms of numbers, how many vaccines are these and from which countries? And my second question is looking at how these African countries are struggling to roll out vaccination programs because of widespread misinformation and people being skeptical and hesitant to taking the vaccines. What help can the WHO offer to these countries to ensure that the vaccines are used and not redistributed if the continent has to achieve herd immunity according to the timelines that has been set? Thank you.
Thank you very much, Rhoda. So I'll request Dr. Mihigo to answer the question on the doses that have been returned by countries to COVAX, but then I'll turn to Dr. Moeti and the Honorable Minister from Lesotho to tell us what we can do to ensure that we get rid of this hesitancy.
Thank you. Thank you very much, Dr. Tuhebwe. With regards to the number of vaccines that have been so far returned to the COVAX facility, we have two countries so far, the Democratic Republic of Congo that have returned 1.3 million doses and which fortunately were redistributed successfully in 5 countries, which had a high capacity of the absorption and the use of these vaccines before they expire. So those were sent to Madagascar, Central African Republic, Angola, Ghana, and Togo. The second country is South Sudan, that also has notified the COVAX facility of some doses that could potentially expire before they are completely used, and there is currently negotiation with the COVAX Secretariat to see how these doses could be reallocated to another country. And I'm sure Dr. Moeti will come back to this because this has been one of our big message that we are sending to country. As much as we can, our recommendation is to encourage, and we do support country to use up the majority of the doses that they have within the country and not send these vaccines back to other countries. We've heard from the Honorable Minister from Lesotho how desperately countries now are to get additional doses. So that has been our position, and we are doing our best to support countries to use up all the doses that are currently available. Thank you, Dr. Tuhebwe.
Okay, so if I can take up where Richard left off, I think it's true that, of course, this happened with these countries, and let me emphasize that when a country has not been able to use its vaccines, of course, we'd like to encourage that the vaccines be used, but it is very good then that they gave an early signal in time for the vaccines to be redistributed to other member states that were ready to deploy them, because what we absolutely don't want is for vaccines not to be used in countries right up to the time that they expire their shelf lives. I'd also like to emphasize that actually the picture is very mixed on the continent. We've had 8 countries that have used up 100% of their COVAX doses. That includes Lesotho, countries like Botswana, Eswatini, Namibia, Rwanda, etc. And we've got other countries that have used up over 90% of their doses, 90 countries. 19 countries have administered more than 50% of the doses they received from COVAX. So the countries have done a lot of work to prepare and to deliver when the time came when the time came for them to receive the vaccines. So what can we do to ensure that reticence, misinformation don't influence people's willingness to come forward and be vaccinated? This needs very strong communication campaigns. In fact, these have started to be put in place in all of the countries. And it needs person-to-person direct communication with people and through channels which the people have confidence in. So we've seen countries work through church groups, work through associations, work through women's groups to make sure that people get the message from those that they trust about the vaccines. We also have, as WHO, with our partners, a campaign, a platform that we call the Infodemic, where we monitor on the social media and other sources of information, incorrect information, fake news about vaccines, and then we factor this into the messaging that is distributed to people. I was very excited to hear the minister say that once the vaccination had started, this triggered a demand which is struggling to fill. We hope that when people realize that some of the concerns that arose when information started to emerge about adverse effects in the early stages of rolling out vaccines, now will understand that these are very rare events. These vaccines are safe. These vaccines are efficacious. When you're in a country, the government will choose the vaccine that is effective against the variant that is circulating there. So we are expecting that this is going to be less and less of a problem, but it does require a lot of communication effort.
Thank you, Dr. Moeti. It was great to hear from Lesotho because the Honorable Minister showed that things are going well. Honorable Minister, it would be good for you to let us know how Lesotho dealt with the issue of misinformation that other countries can learn from.
Thank you very much. We did have prophets of doom when we began this process. And we were also faced with the unfortunate event that our biggest neighbor, South Africa, rejected the AstraZeneca vaccine. Then that cost us a lot of need for information dissemination. But we insisted, particularly, that we can only rely on science and scientific pronouncements rather than hearsay. The other thing that we used was to get our partners, particularly the country WHO office here in Lesotho, was supportive enough to give us more information on the vaccines. And we were able to go on TV, radio, to explain the scientific side of things. The other important event that happened is that when we launched the vaccination program, we used our king, the Prime Minister, and a few ministers, including myself, to demonstrate that these vaccines cannot kill a person. So from that time on the very first day, we were overwhelmed by demand for vaccines. And all the health workers also helped us to understand and to give information to our people. So we have been very successful. We are extremely saddened to hear that African countries are able to return some of these vaccines. It's so unfortunate, but yes, let us have them We need them so much in Lesotho. Thank you very much.
We congratulate the Kingdom of Lesotho for that success that we're talking about. So now to you and Naya with the development today. Kindly go ahead with your question.
Hello, can you hear me?
Yes, we can. Go ahead.
Thank you so much for taking this question. This is actually a question for a piece I'm doing for The Lancet. I would like to ask Ambassador Saidu about comments made by President Macron at the G20 Global Health Summit on May the 20th. There he spoke about the need to correct the weaknesses of the ACT Accelerator. He called for a review of the Act A in view of making it more transparent and inclusive, in his words, if I understood correctly. I believe he also mentioned expanding the mandate of Act A to include manufacturing, in addition to the existing 3 or 4 pillars. So I would like to ask you, please, regarding these comments. Can you elaborate on what Macron means when he talks about the weaknesses of Act A? Regarding transparency, civil society has criticized Act A for this, but what are Macron's main concerns about transparency, and how can Act A be made more inclusive? And regarding the review that he mentions, can you say something about the mandate and timeline of such a review? Thank you so much for any information you can give on these points.
Yes, to you, Your Excellency.
Thank you very much for the question. Pardon, je parle français. Tout à fait, mais en fait, la question est la suivante. Avec cette réponse multilatérale, solidaire, axée sur l'accès équitable et qui a vraiment produit des résultats remarquables, qu'a été ACTA, nous avons réussi à travailler collectivement dans l'urgence. Et quand je dis nous, c'est l'ensemble de la communauté internationale. Ce sont les États, c'est l'Organisation mondiale de la santé, bien sûr, et toutes les organisations internationales de santé, ainsi que les fondations, le secteur privé. Il y a eu donc une mobilisation complète, collective et solidaire, et qui s'est faite dans des véritables conditions d'urgence. Donc, il ne s'agit pas, et avec des résultats que nous voyons aujourd'hui, avec un accès effectif au diagnostic, un vrai suivi de la situation des traitements et un appui sur les traitements qui sont identifiés comme utiles, notamment sur l'oxygène, et puis la situation des vaccins dont on a beaucoup parlé. Donc, il ne s'agit pas de dire qu'ACTA a des faiblesses au sens où il n'aurait pas fonctionné. ACTA a fonctionné et encore une fois, la France a été à l'origine de sa création. Le président s'est personnellement mobilisé et continue de soutenir ce dispositif. Il faut que ACTA finisse le travail, c'est-à-dire il faut que l'on puisse continuer d'avoir une réponse collective, solidaire, efficace, jusqu'à ce que nous ayons réussi mondialement à venir à bout de cette épidémie de Covid-19. Pour autant, il faut reconnaître que quelque chose qui s'est bâti dans l'urgence n'est pas nécessairement quelque chose qui peut représenter le meilleur modèle pour l'avenir et pour continuer à, ce qui pourrait être la réponse de demain. Ça, c'est une autre discussion très active, très intense, bien heureusement, puisque la communauté internationale, et c'est actuellement discuté à l'Assemblée mondiale de la santé, est bien évidemment mobilisée pour construire une meilleure réponse aux futures pandémies. Donc ça, c'est le premier point. Et s'agissant cependant de finir le travail avec ACTA, ça c'est la position française, et le président l'a bien dit, comme vous le relevez, au sommet mondial de la santé, eh bien, il faut continuer d'améliorer l'outil que nous avons pour lui permettre de continuer à délivrer sur son impact. S'agissant de la transparence, il s'agit maintenant de pouvoir avoir une réponse sur les résultats et s'assurer que les résultats au point d'arrivée, c'est-à-dire les vaccins administrés effectivement. On voit qu'il y a un ensemble de freins. Vous avez parlé, la question précédente portait sur l'hésitation vaccinale, par exemple. Mais enfin, quels sont les vaccins qui vont être effectivement administrés? Quels vont être les résultats de ces campagnes de vaccination? Comment est-ce que, effectivement, les plans nationaux qui sont mis en place par les pays ont pu bénéficier de l'aide d'ACTA? Tout ça doit être tout à fait identifié, transparent. Il faut qu'on puisse mettre en regard aussi les coûts engagés. On parle beaucoup des besoins de financement, ils sont importants. On parle beaucoup même des besoins non couverts de financement. Il va falloir aussi être très au clair sur ce à quoi ces financements ont servi, mais pour continuer de conforter cette action collective, bien évidemment. Et ça doit se faire, effectivement, c'est là où les États ont toute leur place. Les États bénéficiaires, bien sûr, de la solidarité via ACTA, mais pas seulement. L'ensemble des États doivent pouvoir faire montre de leurs résultats. Et bien évidemment, la société civile, les représentants des communautés qui ont un rôle majeur dans le suivi des politiques de santé. On le sait en se fondant sur l'expérience notamment de la lutte contre les 3 grandes pandémies, VIH-Sida, tuberculose et paludisme. Et on sait que ces communautés jouent un rôle majeur aujourd'hui dans la façon dont on peut efficacement lutter contre la crise du Covid. Encore une fois, c'est ce que soulignait le docteur Moetti tout à l'heure, en disant que, par exemple, pour lutter contre l'hésitation vaccinale, on a besoin absolument de s'appuyer sur ces relais communautaires qui sont au plus près des populations. Donc, c'est ça le sens, c'est de dire que après la phase d'urgence aiguë, nous avons maintenant une phase de consolidation pour terminer le travail d'ACTA jusqu'à la fin de la pandémie du Covid-19 et qu'il nous faut maintenant avoir une attention particulière pour rendre compte des résultats, que pour rendre compte de ces résultats de façon tout à fait claire et transparente, nous allons avoir besoin de solliciter l'ensemble des États qui bénéficient et qui sont parties et partenaires du mécanisme, comme de la société civile. Et en tout cas, et c'est pour ça qu'on appelle à une évaluation qui va permettre de bien ajuster, là où c'est nécessaire, la suite de l'action jusqu'à la fin de la pandémie, et une évaluation qui certainement pourra éclairer également les discussions en cours sur le mécanisme de demain pour lutter contre les pandémies de demain dans une situation dont on espère qu'elle sera moins marquée par l'urgence que cette fois-ci. Votre dernière question posée sur l'accent à mettre dans ACTA aujourd'hui sur les capacités de production. Alors ça, c'est effectivement une priorité que la France a identifiée depuis maintenant plusieurs mois. Cela fait à plusieurs reprises, notre président est intervenu pour tout à fait mettre au premier plan la priorité que doit couvrir ACTA aussi sur ce sujet. Et je dois dire, avec une réponse qui a été tout à fait engageante de la part des acteurs engagés dans ACTA. Et on a aujourd'hui un travail qui est engagé de manière très active par l'OMS. J'ai parlé tout à l'heure de ce hub pour les capacités de production de vaccins ARN messagers, et avec les autres acteurs d'ACTA, avec un accent pour le moment sur le vaccin, puisque c'est une des urgences les plus aiguës. Mais du point de vue de la France, le sujet se pose bien évidemment sur l'augmentation et la nécessité d'augmenter les capacités de production dans l'ensemble des pays. Et là aussi, on va avoir cette dynamique court terme, moyen, long terme, qui est importante. Et autant on doit pouvoir trouver des solutions immédiates pour augmenter et optimiser l'utilisation des capacités de production existantes, autant il faut saisir l'occasion qui nous est donnée pour avoir une vraie réflexion structurante et de fond sur l'augmentation plus durable des capacités de production dans le monde entier, avec certainement une attention régionale Et s'agissant de l'Afrique, encore une fois, la France, à titre bilatéral au sein de l'Union européenne et au sein multilatéral, souhaite porter des initiatives dont notre président de la République parlera demain lors de son déplacement en Afrique du Sud.
Thank you very much for that information, and we look forward to really hearing more what comes from the discussions. So now the next question is from Omar Mohammed from Reuters, and it goes to you, Dr. Mihigo. Is Africa going to get the 20 million AstraZeneca dose vaccines by mid-July to deliver the second doses? And what will be the impact of or if the continent does not get these doses?
Okay, thank you very much, Dr. Tuebwe. I think as we have heard in the preliminary introductory words by Dr. Moeti, the African region really is looking for the completion of the second doses for those countries that have already started to vaccinate. And our estimates currently stand to around 20 million doses that will be needed by July to make sure that the people who started vaccination can complete their series by then. So the objective of this appeal, both by Dr. Moeti, but also by the Director General of WHO, it's really to make sure that, and we have heard the initiative from France in that regard, that the vaccine donation mechanism become a reality as soon as possible, while the COVAX facility is trying to diversify the portfolio of vaccine to make sure that we'll have enough doses in the coming month. So it's clear that, and we heard it very loudly from the Honorable Minister from Lesotho, that the trust, the confidence that the people have had on immunization for COVID could be altered if really these second doses are being delayed. So I think we do hope that we are going to meet that commitment. It will require a lot of work, a lot of commitment into action from those countries that have surplus doses to make sure that Africa can and should protect at least those people who have already started vaccinated. Now, in terms of consequence, I think WHO is currently reviewing all the data to understand what could be the potential or the consequence of a delayed second dose from the current 8 to 12 weeks up to 16 weeks interval between the two doses. And there are more and more data that are starting to emerge that is showing that, number one, people are not losing the benefit of that they've acquired after the administration of the first dose. Secondly, even if the second dose is a little bit delayed, I think there is a reason to believe that there will be no specific issue with that. And to conclude to that, today there is an extraordinary SAGE meeting that is currently being held now, that is looking at all the evidence that are starting to emerge from the real life delivery of the vaccine. And we hope that we're going to come back to the general audience with some recommendation around the vaccination schedule. But our objective is really to make sure that the country can receive these vaccines as soon as possible so that the second dose administration is not further delayed. Thank you, Dr. Tuebwe.
Thank you, Dr. Mihigo. And now I give the floor to you, Paul Adepoju from Nature, to ask your question.
Yeah, thank you very much. So I'd like to know Dr. Moeti's and other panelists' assessment of African public health institutions' performance in the light of the COVID-19 pandemic. I also like to know your opinions on concerns that vaccination delay on the continent could result in COVID-19 becoming endemic in Africa. Thank you.
Okay, thank you very much for those questions. I think that the public health institutions in African countries have done very well and have done a very good job. I think if we take the example of the Nigeria Centers for Disease Control, which I guess you would be the equivalent of a public health institution, they have managed to expand their capacity. They've gone work not only at the federal level, they've expanded what they're doing down to the state level and are starting to move beyond that level. They have built a lot of capacity extremely quickly in order for the public health institutes to play their role in countrywide, which is, of course, first to have been prepared for the pandemic and then to react and improve their capacity quickly for surveillance, diagnostics, to be able to track and know and anticipate where the virus was spreading and to ensure also that the preventive actions were being taken. So some of these institutes are relatively young. Of course, this is a new problem in Africa, and there are issues of capacity and resources. But I think that they have been up to the job extremely well, especially if we take the one in Nigeria, the one in Zambia, and other public health institutes. Clearly, as part of continuing to build the international health regulation capacities in countries and build this, this part of the public health systems, there is need to invest a lot more in all these institutions. And I just take the opportunity to say that as WHO, we coordinated joint external evaluations of the international health regulations capacities of virtually all of our countries. And all these countries have a plan where they've identified the gaps and they know what needs to be invested in order to fill these gaps. And we are advocating strongly that both from domestic resources and also from international support that these institutes be supported. Is there a risk that COVID-19 could become endemic in Africa? You know, I think scientists in general think with a virus which is new, which is mutating all the time, as we have seen from the emergence of variants, and where, in the case of Africa, vaccination is not moving at the pace that we were expecting. The expectation, not only in Africa, but globally, is that this is a virus that we are going to have to live with in the future. And I think the main objective is to minimize severe illness, minimize mortality, deaths from this virus, and continue to develop the tools that are needed, particularly vaccines, therapeutics, to make sure that we don't have healthcare systems being overwhelmed when countries are going through waves, and that we minimize the harm in terms of deaths. We are very hopeful that once the wealthier countries have managed to vaccinate their populations, we are seeing that in some of these countries now, healthcare workers have been vaccinated, the elderly have been vaccinated, teenagers are being invited to come for vaccination. In the latter part of the year, we can have more vaccine access on the African continent and going into the early part of next year, so that we reach that level of vaccination that's needed to enable African countries to open up and return to a more normal life. So we are anticipating, hoping very much that it will not be endemic in Africa in ways that are different from the rest of the world. That demands the kind of solidarity, sharing of resources, building up capacity to develop and produce some of the tools on the continent that we've been discussing earlier.
Thank you, Dr. Moeti. Honorable Minister, it would be good to hear what you also think with these delays on vaccination in Africa. What do you think, what do you foresee that could happen to us?
Thank you very much indeed. We understand the challenges and do appreciate the challenges that we are faced with in terms of supply. And however, we are also gratified that with the efforts that are being made to unlock this logjam, there are two options for us. The way we look at it, the way I look at it, is that those who have surpluses should be kind enough to return the doses in time. It is also quite important for us that we seriously consider, or these countries that are producing these vaccines seriously consider the liberalization of the patent rights to enhance the development and production of these vaccines. Thank you very much.
Thank you. So the next question goes to Dr. Ngoy Nsenga. It's from Tobeka Ngema with the Daily News. And the question is, in one of the briefings, WHO Africa said they were concerned about South Africa heading for winter. What does WHO think when they see, read, and hear about what is happening in South Africa? What would be your advice to South Africa, especially with these factors and calls for stricter restrictions with the third wave ready to engulf the country? Over to you, Dr. Ngoy. Okay, Dr. Ngoy, if we...
Thank you very much.
Yes, go ahead.
Fiona, and thank you again for the question. Can you hear me?
Yes, I hear you, Dr. Ngoy. Go
Okay,
ahead.
thank you. No, thank you. Thank you very much, Fiona. Sorry for the connection. No, I was saying first we have really to, I don't know if to congratulate or to pay tribute to the government of South Africa, because we know South Africa is one of our countries that was most hit by the COVID in terms of number of cases. But at the same time, South Africa is also one of the countries that really fought hard to bring the situation under control. So South Africa, yes, the situation, at least in some part of South Africa right now, as Dr. Moeti said, we are seeing an upward trend and even resurgence in some provinces. Now, before even going to what should we advise or suggest to the government of South Africa, my reflection on that is, so far, Africa as a whole and the region in particular, we have heard a kind of a winning strategy. We are among the least affected country, region. I believe this is the right decision at the right time, both the political leadership and the public health leadership in the region. So without even vaccine, Africa has not done so bad. That said, I'm not really trying to overplay our success because we are not yet out of the hood yet. But what I'm trying to say is, why should we overlook what so far has worked in Africa and try other? So at this, I want really to emphasize, before even going to what can the government of South Africa do, is what can the people of South Africa do? As the President Kennedy used to say, before you ask what can the country do for you, ask what is really a disease that have highlighted the individual responsibility in the overall responsibility of the community and the country and the world as a whole. So we going back again to individual, trying to emphasize the need and the urgency of continuing to keep all the public health measures. Of course, now that we have the vaccine, and thank God we have the vaccine, and South Africa again is one of the countries that not only has contributed to the global knowledge in terms of science by conducting clinical trial and vaccine, but South Africa has also started rolling out the vaccine. And so far, at least according to the data that I have, more than 500,000 people is vaccinated in South Africa. That's a big step. So yes, now we are going into a situation where, because of the winter and because of maybe the circulation of the new trend, we are seeing another upward trend, or even the risk of resurgence. We need to go back to what made us be successful in the first and the second wave, which was adhering to the public health measures, again, the responsibility of individual, and of course the country and the nation has to take that balance between not closing completely the economy or the need for getting the economy going, but at least the need for preventing against getting into a third wave. That's what, at least now, I believe the country is doing, and that WHO is helping the country to do. Thank you very much, Fiona.
Thank you very much, Ngoy. So now we go to our last questions from Fanuel Adoli from ARD. And the first question goes to you, Dr. Mihigo. What is the worldwide percentage of the COVID-19 vaccine doses that came to Africa?
Yeah, thank you, Dr. Tuebwe. The proportion is really minimal. As of today, only 43.5 million doses has been shipped to Africa, with around 28 million of these doses being administered to people. When we looked at the global supply, this represents less than 2% of the doses that have been made available globally to country. So I think we do have a real gap, an issue of equity, and beyond what we said at the beginning, which is needed to be done, I think there is a need really to accelerate the pace for the delivery of the vaccines. Thank you.
Thank you, Dr. Mihigo. And now the last one to you, Dr. Maweti from Botswana TV. And the question says, Africa's healthcare systems are overwhelmed right now. What are our plans beyond COVID-19 in healthcare, from challenges like doctor-patient ratio to improvement of facilities?
Yes, I think that's a very good question to conclude on, to make the link between responding to a pandemic like COVID-19 and building the basic healthcare systems in countries and progressing towards universal health coverage. We know that there are significant gaps in capacity of the healthcare systems in Africa, starting from the primary care level, the facility which is nearest to where people live, the intermediate or district level, as it's called in some countries or provinces, and then the central level. So I think what we can do is to implement what has been decided at the political level globally, at the United Nations, at the political level in Africa around universal health coverage. So meaning there is need to invest in health. We realize that problems with health can destroy your economy. So no longer think of health as that luxury, whatever, which is what was the thinking in the past. And we need to invest in health in ways that are targeting very much equity, because we've seen that if some people are looked after and others are not, the vulnerability in the whole of society is there. And that means the entire healthcare system, starting from healthcare workers. We have huge gaps in Africa. We need to train more. We need to create conditions where we will retain more of the healthcare workers of different professions, motivate, reward them, distribute them fairly so you don't get concentration in cities and nothing happening in rural areas. And look at other facilities, infrastructure. I think that with technology being available, we have huge opportunities to jumpstart some of these changes, including remote consultations in the current context, so that people don't have to go to a doctor to actually get advice about their healthcare. So I think that this is a big opportunity to move on an agenda that's already very much been agreed upon, and to link it with resilience to a pandemic, and in fact, the response to the COVID-19 pandemic today. And we as WHO are working with partners and governments to pursue this agenda at the same time as supporting the response to the pandemic.
Okay, thank you, Dr. Moeti. So we are coming to the end of this virtual press conference, and I'll request our panelists to give us their closing remarks, and we'll have a minute each. I'll start with you, Honorable Semano Henry Sekatle, the Honorable Minister of Health from the Kingdom of Lesotho.
Thank you very much for having us. It has been a fruitful and informative discussion. We have learned in Lesotho that the so-called waves of this pandemic are in fact a direct result of our day-to-day decisions. We need discipline, we need resilience, we need to be altogether focused on preventing rather than dealing with the cases of COVID. So thank you very much indeed. Thank you, Dr. Moeti.
Thank you, Honorable Minister. And as I hand the floor to you, Your Excellency Stefan Sedu, in your concluding remarks, could you also help us address the question that what can we do for Africa to get equitable distribution of the vaccines?
Merci beaucoup. J'aimerais dire trois choses à l'issue de cette conférence. La première, c'est que comme l'ont dit certains intervenants, l'Afrique a joué un rôle majeur au plus haut niveau de mobilisation politique et scientifique et a montré qu'elle était régionalement un acteur de premier plan dans sa capacité à se mobiliser dans une crise de cette ampleur. On l'a vu par les prises de position de certains grands leaders, on l'a vu aussi par la mise en avant d'un acteur important comme le CDC Afrique, le rôle aussi joué par l'Union africaine. Je rappelle que l'Afrique du Sud est le co-président de ce conseil ACTA et on l'a vu par également l'excellence scientifique manifestée par un grand nombre de centres en Afrique. Je pense entre autres à l'Institut Pasteur de Dakar, mais il y a bien d'autres exemples. Et c'est, je crois, quelque chose qui restera et qui est un point saillant. Et je ne mentionne pas naturellement le fait qu'on a des grands dirigeants issus de l'Afrique à la tête des deux organisations majeures aujourd'hui que sont l'OMS et l'OMC. La deuxième chose que j'aimerais dire, c'est que la France s'est mobilisée depuis le début. Je ne vais pas revenir sur tout ce que j'ai dit. Elle reste mobilisée. Elle le sera sur le plan financier. Le président de la République a annoncé un nouveau soutien de 500 millions d'euros qui s'ajoute à la première contribution française pour ACTA. Nous sommes mobilisés aussi politiquement pour encourager nos partenaires à donner des doses et à agir en matière d'augmentation des capacités de production. Je ne reviens pas sur ce que j'ai dit. C'est pour moi, pour répondre à votre question, c'est pour la France, les deux axes les plus immédiats, les plus importants à renforcer maintenant. Et la dernière chose que j'aimerais dire, c'est, et ça je reviens encore au propos du Dr Moeti, et c'est effectivement cette vision qu'il faut avoir sur la durabilité des systèmes, les enseignements à tirer sur le fait qu'on a, avec cette crise, l'opportunité de faire la démonstration que l'investissement en santé est un investissement qui soutient le développement économique. Il y a eu un sommet le 18 mai pour le financement des économies africaines à Paris qui a effectivement proposé un grand nombre d'orientations pour ancrer au plus haut niveau politique cette conscience de la nécessité d'investir en santé comme on ne l'avait jamais fait jusqu'à présent, à la fois pour se défendre contre les prochaines pandémies, mais aussi en tant que tel pour augmenter les capacités globales de développement. Et ça, c'est un message qui est très porté par l'Afrique. Et c'est peut-être une démonstration qu'on peut transformer en quelque chose de très positif à l'appui du soutien à la couverture santé universelle. qui est aussi un objectif global que la France soutient, bien sûr, de façon très appuyée, et que cette crise peut, si nous continuons de jouer de façon collective, solidaire, intelligente, et que cette crise peut permettre d'atteindre et non pas de renvoyer en arrière. Merci beaucoup.
Thank you very much. Very reassuring words and optimism right there, Your Excellency. So last but not least, to you, Dr. Moeti, and in your concluding remarks, would like you to answer this question. The World Health Organization was reviewing the COVID-19 data from Seychelles following the spike in cases despite a high rate of vaccination. Is it possible to update us on the progress, if any, on what could have been behind this rise?
Yes, thank you. Thank you for that question. We know that Seychelles is, in fact, one of the most vaccinated countries around the world. About 63% of their population is fully vaccinated. However, they have seen some cases after a big vaccination drive had been carried out, and also 35 people have died. In addition to that, we know that the B1351, so the variant that was first identified in South Africa, was also identified in Seychelles, though it's not clear to what degree it is circulating. I think the most important takeaway from this is that, yes, indeed, people who were vaccinated also became ill. But what's also very clear is that of those who became severely ill, requiring to be hospitalized, 80% were among people who were still unvaccinated. And the most critical cases were all unvaccinated. So we know that these vaccines will not necessarily stop you being infected by the virus, but what we are looking for initially as benefit and value from the vaccine is preventing severe illness and preventing death. So I would say that this is a situation in the Seychelles at the moment. I know that the government, and we have sent an expert there to support the analysis further to understand what happened. But what we do know is that certainly there were not, among people who were vaccinated, severe illness and deaths, and therefore the benefit from that vaccination did happen. I'd like to conclude then by, again, thanking very much my fellow panelists, the Honorable Minister and Ambassador Seydu, for having joined and shared with us your perspectives, your experiences, and your recommendations for the future. And just conclude by saying that we in WHO advocate strongly for this solidarity in sharing vaccines now and in sufficient quantities to make a difference in the African region and to cover the gap of vaccination of African people. And we'd like to say that this is very much solidarity, it is support for a region, but it's also self-interest, because we know that as long as the virus continues to circulate highly in some regions, mutations will occur, variants will occur, and we will have the problems, even in countries where vaccination has been carried out, of having to always contend with these variants coming in. So it really is solidarity, but also looking after oneself. And finally, for our countries in the African region, we are having reversals. The pace is slower than we expected in terms of vaccine acquisition. I'd like to urge that we use this time to catch up, refining our planning, making sure that we are putting in place all that is required, that when the vaccines arrive, we roll them out in ways that in some countries need to be better than what is happening now. We have a significant number of countries that have received vaccines, but where quite significant proportions are still not rolled out due to capacity issues, financing matters. So I'm really urging that, and we are here as WHO to support, to review the plans and make sure that the readiness is such that as the vaccines are arriving, we're able to roll them out like those countries that have managed to use 100% of what they received. Again, thank you very much to our colleagues, journalists, for having joined us today.
Thank you very much, and indeed sincere gratitude to you, our panelists and our journalists, for joining us today. We are at the end of the press conference, and do have yourselves a good day.
Thank you.